Never miss a breaking news with Prudent notification. Watch Prudent TV live on.
What are the preparedness made by Government of Goa for third wave? Yesterday we had a meeting chaired by Honorable Chief Minister and the Health Minister, Honorable Health Minister, which is a task force committee of the state of Goa. After that meeting, there were some decisions which were taken, and then we were told that there is an expert committee to guide the government on third wave. As you are aware that third wave is likely to affect the children and people below 18 years. We want to be prepared in all its aspects, and since it is going to be a pediatric age group, the expert committee has some of the renowned pediatricians and the people who are in the field of neonatology and pediatrics. So the committee consists of the practitioners from Goa Medical College as well as the private practice. With me I have today Dr. Mimi Silvera. She is a head of Department of Pediatrics, Goa Medical College. To my left, Dr. Harshad Kamath. He is renowned pediatric practitioner in South Goa. So I would request them to speak on the subject per se, on the what are the important issues of a third COVID wave.
Headed by Sir Dean of Goa Medical College, we took stock of the situation that is there. We considered what are the problems that are peculiar to the pediatric age group, and we have decided as a committee to suggest a few points to the government as to how we can be better prepared for the eventuality of the third wave becoming a reality. The first thing is what we looked at is what is our existing infrastructure and how best we can ramp it up to meet that particular figures if they do occur. Now we are looking at the worst case scenario. We are hopeful and hoping and praying that it doesn't happen. But looking at what happened at the second wave, we are obviously better prepared for that eventually will happen so that we can cope with it better. The first thing is we have three age groups to consider. Particularly one is the newborn, which is one peculiar age group. Second is the general pediatric age group, and the third is the adolescent age group, which is between 12 to 18. So we have looked at what we have as a newborn baby beds required, what we have in the pediatric age group, and where we can accommodate the adolescents. So looking at whatever existing infrastructure is there in Goa Medical College and in the district hospitals, both north and south, and what we have in the private sector, we have made a few recommendations and suggestions how to ramp it up. Secondly, we have made particular focus on home monitoring, where that is going to be the crux of the management of all children if and when the wave, or even if despite the wave, whatever situation is there, it is the age group where home monitoring becomes very important. There are certain requirements that are there requiring, such as the medications, oximeters peculiar to the need for pediatrics. So we have made some recommendations on that. We have also looked at what counseling may be required, because mothers with babies who are sick and parents in general get very stressed. So we have looked at that aspect also. And finally, we have also looked at very important aspect, that is vaccinations, that would cover this age group, not below 18 years per se, because that's not permitted as of now, but mothers who are lactating, who should be, there was a lot of debate earlier, they used to think not required, but we now know it's definitely a positive to vaccinate all lactating mothers, because they would pass on the antibodies to the babies and also be in a position to handle the babies if, God forbid, the child tends to pick up COVID later on. So this is one age group we have recommended to the task force to suggest we put on priority basis. So that's what we have sort of come down to. These are the points we have highlighted.
All along now, we used to say that only those that had flu-like symptoms, cough, would, children with that would come running to it. But we know that COVID also can manifest with other symptomatology, like even diarrhea, vomiting. It can come with rash, They can come with some skin lesions. So any child that is sick with all these things should really approach the doctors. Another group that we have seen that could have problems are those that have comorbidities. There are children with heart problems, there are children with diabetes, there are obese children that could be, with COVID, these diabetes come up suddenly. So those children that have these comorbidities, whether it is cardiac, whether it is kidney problems, whether it is like cerebral palsy, the disease can progress a little faster. So it's better that these children who have these symptoms should approach the doctor so that the needful can be done. There are some children also on medications, like even long-time steroids. So their immunity comes down. There are some cancer children on who are on anti-cancer drugs, so their immunity is down. So these are the children that should really approach early rather than wait for complications to occur. So I think that would be the most important thing that I would like to tell the public, to be more aware. I don't have the exact figures now, but it is not a very high number that are admitted. Yeah, that's one good thing about the children so far. What we have noticed is that they can get positive. Yeah, it's hovering around 12% that become positive, but those that need admissions is much less. So they do not get severe symptoms of COVID as of now. So they are not.
There are 33 newborns who are admitted.
Yes.
आम्ही पळयल्या प्रमाणे फाटल्या वर्सा around 7 to 8% भुरगीं पॉझिटिव्ह येतालीं. Out of all those who are tested positive. पण फाटल्या 3 म्हयन्यान आमच्या लक्षात आयलां की साधारण जे गोंयांत टेस्टेड पॉझिटिव्ह आसा फॉर कोवीड, ऑन एन एवरेज 10 ते 12% आर चिल्ड्रन बिलो द एज ऑफ 18 years. सो 18 वर्सां सकल भुरग्यांचे कोवीड जाल्ले प्रमाण मातशें वाडत चल्लां. सिंगल डिजीट आशिल्ले 8-9% ते आतां 11-12% पावलां. सेम इज द पॅटर्न ऑल ओवर इंडिया. इवन ऑल ओवर इंडिया अंडर 20 years comprise 12% of all confirmed COVID cases as of now. So आज आमच्या कमिटीन doctors from GMC, doctors from IAP, under chairmanship of our dean at directions of Honorable CM and HM, we met and discussed various issues. Most important is infrastructure requirement. आम्ही assessment केले की साधारण ऑल ओव्हर गोवा 101 न्यूनेटल ICU युनिट्स आसा आणि आज डिसिजन घेतला की ते 101 NICU बेड्स जे आसात ते एक्स्ट्रा 10 बेड्स GMC सुरू करतले, प्लस नॉर्थ गोवा डिस्ट्रिक्ट हॉस्पिटलान एक्स्ट्रा 5 बेड्स सुरू करतले इमिजिएटली. आणि जसे पर्सेंटेज वाडटा तसे इट माइट बी स्केल्ड अप इन डेज टू कम. दुसरे PICU पिडियाट्रिक ICU बेड्स सध्या 36 आसा गोंयांत. आणि आमच्या कमिटीन आज डिसायड केला की वेळ जर आयली जाल्यार अराउंड 20% ऑफ दी एडल्ट ICU बेड्स वी कॅन कन्वर्ट टू द पिडियाट्रिक ICU बेड्स. त्याच प्रमाणे SNCU बेड्स म्हणून आसा नॉर्थ गोवा डिस्ट्रिक्ट हॉस्पिटलान विच आर 5. सो सध्या आयज पॉझिटिव्ह गोष्ट जी आसा, प्रायवेट डॉक्टर्स फ्रॉम द पिडियाट्रिक फ्रेटर्निटी and government doctors from GMC and DHS have come together, and IAP चे डॉक्टर्स पिडियाट्रिशियन्स आणि स्वतःहून सांगला की आम्ही डॉक्टर्स येऊन आमच्या सरकाराबरोबर काम करपाक तयार आसा ॲट अ डिस्ट्रिक्ट हॉस्पिटल ॲट GMC. आणि एक प्रपोजल आज आम्ही मांडले त्यांच्या समोर, ते IAP कडे डिस्कस करून आमकां येतले की निदान एक प्रायव्हेट पिडियाट्रिक हॉस्पिटल नॉर्थ गोवा आणि निदान एक प्रायव्हेट पिडियाट्रिक हॉस्पिटल साऊथ गोवा गरज पडली जाल्यार कोविडा खातीर ते काम करतले. ते डिसिजन आम्ही IAPचे सकयला. ते पिडियाट्रिशियन सगळे साधारण 130 आसा ते डिसायड करतले. सगळ्यात महत्वाची गोष्ट आज जी डिसायड जाल्या ती स्टँडर्ड ट्रीटमेंट प्रोटोकॉल. 10 मे ह्या दिसा ऑल इंडिया इन्स्टिट्यूट ऑफ मेडिकल सायन्सीस अँड PGI चंदीगडचे डॉक्टर्स एकत्रीत येऊन मिनिस्ट्री ऑफ हेल्थ गव्हर्मेंट ऑफ इंडियान एक वेबिनार केल्लो. आयज आम्ही तो आमच्या एक्सपर्ट कमिटी मुखार मांडलो. माइल्ड केसीस इन चिल्ड्रन, मॉडरेट केसीस इन चिल्ड्रन and severe cases in children कशे तरेन हाताळपाचें ते, so that there is uniformity in treatment. All of us doctors government and private treat the same way. So mild treatment protocol, moderate and severe treatment protocol was accepted today. जो एम्स प्रोटोकॉल आसा तो आमी फॉलो करतले गोंयान आनी त्या खातीर जी वखदां आसा इंट्राविनस इम्युनोग्लोबुलिन, मिथाइल प्रेडनिसोलॉल म्हणटा ते स्टिरॉइड, पॅरासिटामॉल सिरप, विटामिन सी, झिंक, विटामिन D3 हे कमिटीन आज रिकमेंड केला. आमी सरकाराक बरोवपा आसा की हे मेडिसिनाचे आमी इंडेंट करतले. कित्याक जी वखदां एडल्ट्साक वापरतात, रेमडेसिवीर, फेविपिरावीर आनी ते टॉसिलिझुमॅब ते भुरग्यांक वापरपाक मेळना. इवन आयव्हरमॅक्टिन, डॉक्सिसायक्लिन तांकां वापरपाक मेळना. सो भुरग्यांचो ट्रिटमेंट वेगळो आसा. एकच बरी गोष्ट कितें आसा की भुरग्यां भितर मॉडरेट टू सिवियर डिजीज तितले प्रमाणात जायना जितले जाणट्यांक जाता. सो म्हत्वाची चवथें डिसिजन आज घेतला तें ट्रेनिंग करपाचें. सो मॅडम प्रोफेसर ऑफ पिडियाट्रीक आनी डॉक्टर चेतना म्हणटा ती पिडियाट्रिशियन नॉर्थ गोवा डिस्ट्रिक्ट हॉस्पिटल आसा, तांणी रिस्पॉन्सिबिलिटी घेतल्या की नॉर्थ गोवाचे सगळे डॉक्टर्स, गव्हर्मेंट, प्रायवेट, मेडिकल ऑफिसर, जनरल प्रॅक्टिशनर आनी जे कोण इवन कन्सल्टंट शिकपाक सोदतात, दे वील अटेंड दीस ट्रेनिंग थ्रू वेबिनार. त्याच प्रमाणे साऊथ गोवा डिस्ट्रिक्ट हॉस्पिटलाची डॉक्टर आयरा आसा आनी IMAचो प्रेसिडेंट डॉक्टर विनायक बुवाजी आनी IAPचे डॉक्टर हर्षद कामत आनी बाकीचे आसात तांणी, डॉक्टर उगांवकर फ्रॉम फोंडा, तांणी डिसिजन घेतला की साऊथ गोवाचे सगळे डॉक्टर्स त्या प्रमाणे तांचे ट्रेनिंग ऑनलायन जातलें. अशें करून आमी फुडल्या 2 म्हयन्या भितर थर्ड वेव जी तरुण भुरग्यांक जावंक शकता, ल्हान भुरग्यांक जावंक शकता, ताची तयारी सरकाराच्या इन्स्ट्रक्शनचेर आज सुरू केल्ली आसा. वॅक्सिनाचेर जशें डॉक्टर हर्षद कामतीन म्हणलें, 18 ते 44 वर्सां भितर वॅक्सिनाची कमतरता आसा खरी, पण 2 प्रायोरिटी ग्रुप्स आयडेंटिफाय केल्या. एक म्हणजे जे आवय आसा जांची भुरगीं 2 वर्सां परस ल्हान आसा, तांचे बर्थ सर्टिफिकेटचेर आमकां कळटलें. दे आर लॅक्टेटिंग मदर्स, तांकां प्रायोरिटीन कन्सिडर करचें म्हणून इन द 18 to 44 एज ग्रुप, कित्याक तांचे पासून भुरग्यांक जावं येना. आनी दुसरें 18 to 44 भितरूय बी थोड्यांक डायबिटीज आसा, अल्कोहॉलिक लिवर डिजीज आसा, रिनल फेलियर आसा, हार्ट डिजीज आसा, तांकां बी कोविडाचे कॉम्प्लिकेशन चड जावंक शकता. सो वी हॅव रिक्वेस्टेड द डिरेक्टरेट ऑफ हेल्थ सर्विसीस की 2 ग्रुपाक तुमी वॅक्सिनेशन प्रायोरिटीचेर दिवचें. तांचेर जर भर दिलो वॅक्सिन दिवपाक जाल्यार डेथ रेट आनी देंवतली. Expert committee's recommendation, which will be placed before the task force, and today it has been placed before Director of Health Services. So state जे वॅक्सिन परचेज करतात ते जर कमी पडटा, पयलीं ह्या लोकांक दिवचें जांकां चड गरज आसा. मागीर आपोआप ती भुरगीं प्रोटेक्ट जातली जांची आवय तांकां वॅक्सिन दिता तांकां. Now it has been declared by all international agencies, Government of India, that lactating mothers can be vaccinated.
No, see, in that 18 to 44, and that subgroup is which is going to affect the third wave. That is what he is trying to say. See, lactating mother with 2 years old children will be taken as one subgroup, and then people in this who have comorbidity like diabetes, kidney disease, and hypertension with IST, that will be a second subgroup. So if you get a stock of vaccine, these people will be given, these subgroups will be given priority as compared to the full lot of 18 to 44. You understood? You see, because we see that third wave transmission would be from parents mostly, or that kind of a block we want to do prophylactic block there. So that is the decision, and I think this is a very valid decision by the expert committee. This committee is expert committee. We have to put our full decision to the task force committee, which is headed by Honorable Chief.
What is the population which is below 18?
It is about 3.2 lakh. 3.2 lakhs is the below 18 population. No?
Below 12 years
Below
is
12
about 2.5,
Yeah.
and below 18 years is about 3.5 to 4 lakh.
4.5 and half.
Below 12, 2.5 lakh is the estimate. कित्याक वर्साक सादारण 25,000 डिलिव्हरी जाता. 22,000 जर धरले डिलिव्हरीज पर इयर, मल्टिप्लाय बाय 12, आनी तितले मल्टिप्लाय बाय 18 जर केले जाल्यार बिलो 18 मेळटा. सो सादारण वी आर लुकिंग एट प्युअर पिडियाट्रीक अंडर 12 इज 2.5 लाख ते 3 लाख, आनी अंडर 18 इज अबाउट 3.5 ते 4 लाख. आनी ही एंटिसिपेटेड आनी एक्सपेक्टेड आसा. आमी जे हॉटस्पॉट प्रेडिक्शन गोंयान जे म्हजे डिपार्टमेंट करता, आमच्या हॉटस्पॉट प्रेडिक्शना प्रमाणे 160वा रिपोर्ट जो आम्ही तयार केल्लो दॅट वॉज एक्झॅक्टली 1 month बॅक ऑन 19th of April. त्या दिसा आम्ही स्पॉट मॅपाचेर प्रोजेक्ट केल्ले की बार्देस तालुका, तिसवाडी, सालसेत, मोर्मुगांव आणि टू सम एक्सटेंट फोंडा हातूनच चड हॉटस्पॉट्स आसात. कालचो जो आम्ही रिपोर्ट तयार केलो विच इज अवर 183rd रिपोर्ट, नाव इट इज गोईंग पेरी अर्बन आणि रुरल. ऑल ओव्हर गोवा वी सी स्कॅटर्ड हॉटस्पॉट, 206 हॉटस्पॉट्स आसात. मॅसेज बेजिकली गोंयकारांक आमी दिवपाक जाय ही, अशें न्ही की पयली वेव जाण्टेल्यांकच जाली तातूंतय बी तरणाटे आशिल्ले, अशें न्ही की सेकंड वेवाक फक्त तरणाटेच हे जाले, सगळे एज ग्रुप आशिल्ले. प्रोपोर्शन ऑफ एज ग्रुप चेंजीस. ही थर्ड वेव जी येवपा आसा अशें न्ही की भुरग्याकच आमी गैरसमज करून घेवपा जायना ओनली चिल्ड्रन वील गेट द थर्ड वेव. एवरीबडी इज गोइंग टू गेट इन्फेक्टेड इन द थर्ड वेव. But proportion of children and adolescents under 18 is likely to slowly increase. How much increase it will be depends on virulence of organism, infectivity of the organism. It depends on whether schools reopen or not. It depends whether people become complacent and again start having crowded gatherings. It depends on many factors. Human behavior is also most important. Any amount of rules cannot help unless COVID in appropriate behavior is not followed. मॅसेज पब्लिकाक पावपाक जाय ही, सिमटम्स निग्लेक्ट करनाकात. कसलेय सिमटम्स जाले ताबडतोब डॉक्टरा फुड्यान सल्लो घेयात. डोंट प्रिज्यूम की तुमकां कोवीड जाला काय सदांची थंडी. मॅडमीन म्हणलें तशें आतां पावस आयलो, संडास पातळ जावप, थंडी जावप, डेंगी, मलेरिया हे सगळे सिमटम ओवरलॅप जातले. लोकांचो गैरसमज जावपाक जायना की हे दुयेंस अमकें आनी तमकें. ताणें डॉक्टराचेर सोंपोवपाक जाय, गव्हर्मेंट जावं प्रायवेट. ताबडतोब ट्रिटमेंट घेतलो जाल्यार जीव वाचता. लोक फाटी रावता म्हणून प्रॉब्लेम जाता.
Third wave mostly predicted by epidemiologists is in month of September. September.
Any recommendation for any reopening of the schools now?
This is prediction, huh? This is, don't take it as a
No,
fact.
but that seems
I had a discussion with epidemiologist, so he said.
Yeah, I would. But considering that third wave would likely affect children.
Can you open this please?
So are you? I mean, what is your recommendation of the expert committee pertaining to reopening of schools?
No, committee has already said that reopening should be looked at that time, because considering the incidence of infectivity, and if there is need, committee will also give an opinion not to reopen. Committee will give that opinion because no,
That was
No.
We didn't discuss that.
that we didn't discuss today. And if when time comes, and if suppose expert committee feels that the school should not be opened, at that time committee will suggest to the task force committee. We had one referral from private hospital.
So now we have 6.
Yeah. Now we have 7.
7 or 6?
7. Huh?
7 is one day.
That is COVID death.
7. But patients, total patients, how many doctors?
Now right now 7. We got one more referred from private hospital.
So now 7 patients are
Yeah.
getting.
Treat.
And sir, any considered in the private hospital?
Yeah. See, the central government has allocated us 100 yesterday. We already placed a purchase order. Today I got one more letter asking that we will get another 50 allocation. We have already asked for 2,000, and I think over a period we will get this required stock. Now the amphotericin, this is liposomal. Liposomal is a separate kind of amphotericin B. This is allocated now through the central quota. Nobody can buy it and keep. Understood?
So you have placed order for 2,000?
2,000 also. Our central pharmacy has placed an order for 2,000, and we all liposomal amphotericin B. And then we have identified a separate ward now for black fungus patient, and we'll keep all these patients there.
Okay, so private hospital has to be approached to
One patient, they had referred one case yesterday. Finally the patient only is referred here, so we are treating him. We are treating him.
Patient were undergone surgery endoscopy.
Yeah. They are doing well. They are doing well. Next time I will keep my ENT specialist who is treating them so that we can get the information. Okay? Anything else? Thank you. Thank you.